Hi, I'm Savannah with iHeartRadio Community Access, and today I am joined with Dr. Jean Weigert and Dr. Efaza Siddiqui. They're both from Jefferson Radiology, and we are so excited to be talking to you guys today. Thank you so much for being in studio.
Thank you for having us.
It's our pleasure.
All right. Well, there's a lot of things we got to talk about, but first of all, I want to talk about the things that you guys do at Jefferson Radiology. So, for listeners who may not be familiar, can you tell us a little bit about your organization and the role that you play in our community?
Absolutely. So we're radiologists with Jefferson Radiology and Hartford Healthcare. As radiologists, we're often behind the scenes, but we're actually on the front line of cancer detection. Every day, we use imaging to detect disease, often before patients even have any symptoms. So the idea is to detect disease early. One of the most rewarding parts about our job is finding cancer early when treatment is most effective and the outcomes are significantly better.
I can say firsthand, I've had some cancer scares in my family. I've had some family members that have gone through the process, and early detection has been a really, really big thing. You guys actually interpret nearly 1 million images every single year. That's insane. Like, what does that say about your impact on the community?
Well, I think that Jefferson Radiology is a proven part of our community. We feel we are part of the Hartford County environs. You can find us everywhere. And we do a variety of different studies. My role is predominantly breast care, which is certainly huge. Every woman, by the time she's 40, should have a screening mammogram, and every year after that. And then if you have risk factors, which are now really being developed, this concept of personalized care, where our risk is assessed and decisions are made whether or not you need to start your evaluations earlier in your 30s, because unfortunately we do find breast cancer in younger populations.
It's crazy. And I feel like, a lot of people like me, we work a lot. We're busy. We're like, oh, it's fine. It's a weird thing. I'm having a lymph node flare up, or, oh, I'm tired because I've been working a lot. It's really important to pay attention to your health and what your body's trying to tell you.
Absolutely. And what I say to patients all day long is there are no bad questions when it comes to your body. We have women that come in for all sorts of symptoms. The good news is 90% are nothing.
Yes.
But the relief on their face when we walk into that room and say, everything looks fine, is worth it. Now, of course, there are times when we have to say, you need to have a biopsy.
Right.
But we do it in a way that we make them understand that it's because we need to know what's going on. We're not sure. It may not be anything, but let's find out as early as we can.
Absolutely. And like you mentioned, there are no bad questions, no dumb questions, especially when it comes to your health, right? It's really important to advocate for yourself and to have the tests and the imaging to know what we're dealing with.
Absolutely. I feel like one of the biggest misconceptions, like you said, is, I feel healthy. I don't think I need any screening or any tests. That is a huge misconception, because I think we need to understand that a lot of the cancers actually show up much later. Like, you won't have any symptoms until the disease is like much further advanced. So the whole idea behind having cancer screening is so that you can detect disease early, even before it has any symptoms. And that is when, once you nib it at the bud, if you will, and then, the treatment outcomes are much better, and the chances of recovery and prognosis are much better.
And speaking of cancer, you guys have been partnering with the Hartford Yard Goats for Strikeout Cancer Night, 8 consecutive years. Talk to me a little bit about this partnership. How did it all start?
Yeah, so this is our 8th year partnering with Hartford Yard Goats, and we're very proud to continue this tradition. While it is a fun event at the ballpark, the bigger purpose is to just raise cancer screening awareness and, talk about cancer screening and early detection. Many people know that they should get screened, but they often don't know where to start or what the appropriate studies are. The whole idea behind having such events is just to create awareness, talk about these things, have discussions, and, hopefully encourage someone to get the appropriate screening done at the right time, just so that they can, get the appropriate management if needed, and hopefully, encourage someone to save their life.
Absolutely. And this is all going to be happening Friday, August 14th. So what can everybody expect if they attend? Where can we get tickets? Like, break it all down. I want to go.
All right. Well, you'll be able to join us for the fun night right there at the Yard Goats Yard. There's going to be a big booth put on by Jefferson Radiology. We're going to have a
Yes.
raffle, and it's pretty easy to do. And last year I went, and it was a blast. I actually got to open it with a Go Yard Goats moment.
There we go.
And it was a lot of fun. I want to touch base back onto the screening.
Yes.
It's not just breast screening that's so important. It's very important now. We do lung screening for people who have been long-term smokers. Lung cancer has traditionally been one of the hardest cancers to treat, diagnosed usually when it is very far gone. But now with CT scan, low-dose CT scans, for people who have had a long-term smoking history, we can find tiny cancers and treat it very, very early.
Wow.
The other cancer screening is for colon cancer. It used to be that it was recommended after 60 to start having colon screening. And again, colon cancer has become very cunning and baffling. And it's really now recommended that by the time you're 45, you should be having colon cancer screenings. And there are different ways of doing it. There's X-ray colonoscopy, and there's regular colonoscopy. But if you fill the criteria for an X-ray colonoscopy, it's very simple, very easy. And again, you can be nipping something in the bud, because finding a small lesion in your colon, it is cured if it is removed. So these are the things that we really, really, really think are important. It would be nice if we could scan for every single cancer there is. But these are really big cancers. They're ubiquitous. Breast, colon, and lung. And the fact that we've made such great strides is really wonderful. And that's what we go to work for every day.
And I will absolutely endorse everything you just said on colon cancer. My granddad actually passed of colon cancer. He was in remission. It metastasized. It is nasty business, for a lack of better words. So yes, don't put the colonoscopy off. I know it's not fun. Nobody likes the prep of it, but it's worth it because you can save lives. And the more that we do it, the more we get educated on how to stop these kinds of cancers, correct?
Exactly. Again, breast cancer has come a long, long way. I've been in practice for over 30 years, and I've seen so many changes, both on the imaging side and on the treatment side. But the awareness stays so hard. I still see women who don't come in yearly, and when they miss 2 to 3 years, they come in with a positive finding that would probably have been found earlier. It's not hard to get your mammogram. It's not hard to get a breast ultrasound, which is what we also recommend if you have very dense breast tissue. These two tests combined can find a lot of cancer.
And I think it's so important. And we just kind of keep coming back to the fact of, we always want to put off our own health. Oh, we're fine. Oh, we're good. Oh, we're busy. We have this, that, and the other thing to do. But your health is such a priority, and we need to make it a priority. And I feel like especially with women, because all out of time we're trying to be super women. We have the kids, the job, the cooking of the dinner, everything else. But we need to prioritize ourselves and our health.
Right.
Absolutely. And I would just add to what we were talking about regarding colorectal screening. I think the moment you hear about colonoscopy, people are just, a little bit scared about it being so invasive, potentially needing anesthesia, things like that. So I just want to add to it and say that there's actually potentially other screening options that I just want to raise awareness about. There's stool-based tests, such as, looking for blood and stool, for instance. But as far as radiology, like Dr. Weigert mentioned, we actually have CT colonography, which is actually a minimally invasive test. So there's actually nothing that is actually going down your colon. It's essentially just prepping for the study by taking something orally, and then eventually you just get a CT scan. And the idea behind that is to also look for any potential polyps or, evidence of cancer. So it's much less invasive than colonoscopy. There is certain criteria. So you have to speak with your PCP and find out if you fit that criteria or not. But that is potentially an option out there. And sort of adding to, the potential cancer screenings that one should know about. I would also like to quickly mention prostate cancer, for instance.
Yes.
There are lab tests available. It's called a PSA test, and that's basically a level that we look for to see if you would potentially need further evaluation, such as with MRI of the prostate. And if we do find anything that looks suspicious, you would either end up following it up, or you may eventually need biopsy. But, again, it's one of those things that, the sooner you catch it, the better your outcomes are going to be. There are a couple additional things that I just quickly want to touch upon.
Of course.
There is, certain genetic risk factors. So, for instance, things like pancreatic cancer or ovarian cancer. So, again, this is a conversation that you need to have with your primary care provider. And if you do fit the criteria, if you have any personal or family risk factors, then you may potentially need screening for those exams as well. So, it's very important to have those conversations just so that you can get that kind of individual risk factor assessment.
As a added factor for our mammography now, every screening mammogram includes a risk assessment. Our technologists have questions that they ask the patients routinely, and we have a special program now called the Tyrer-Cuzick score, and it is now being calculated and placed onto the report that every patient gets.
Wow, that's amazing.
If you are greater than 20% risk, we have a whole section that talks about talking to your PCP about the fact that you may be it may be necessary or thought to be a good thing to have an MRI in addition to your mammogram or other kinds of higher risk treatment. If you fall below 10%, you're in the normal low risk, but you still need your mammogram every year.
Absolutely.
And if you're in between, we're learning what we can do to help improve that. But having the data of this risk assessment, which we now give to every single patient, is so important. So again, value added. When you come for your imaging, we try and give you more. We try and give you things that you can learn about. And if you have any questions when you're having your screening CAT scan, your screening mammography, whatever, our technologists are highly trained to be able to discuss the information, and the radiologist is always available to talk to you.
I love it. Education, advocacy, being proactive about your health. That's the main message. Thank you so much. From Jefferson Radiology, Dr. Jean Weigert and Dr. Efaza Siddiqui. Thank you guys so much for sitting down with us today. And I will just wrap up by saying, maybe someone can fact check me, but I feel like you can walk down the street right here in Hartford and find tons of people that are touched by cancer, whether it's themselves, somebody they know, a family member, a friend. So if you know somebody who's late for the colonoscopy, late for the mammogram, who's got something going on that they're pushing to the side, advocate for them, have them advocate for their health. And at Jefferson Radiology, that's what you guys do every single day. Thank you guys so much for being here today.
Thank you.
Thank you.